Okay, hi everyone. Now we are going to see a case history which is related to major depressive disorder. Okay, let's start the discussion. We'll see the patient's detailed history of his illness. Yes?
Name Liam, age 32, gender male, occupation software engineer. Liam presents to therapy at an urgent of his wife, feeling constant tired and sad, having no energy for anything, and losing interest in everything he used to enjoy. His wife reported concerns about his significant weight loss, sleep disturbance, and increasing social withdrawal over the past 6 months. History of the present illness. Liam reports that his symptoms began gradually approximately 8 years ago, shortly after a major project at work was complete. Initially, he attributed his fatigue to post-project burnout. However, his symptoms progressively worsened. He described a low mood, often feeling tired, even in activities that previously brought him joy, such as playing video games, hiking, and spending time with his friends. He reports significant feeling of prone lack of motivation and physical energy. His sleep has been significantly disturbed. He often wakes up in the middle of the night and struggles to fall back asleep. Or he wakes up much earlier than needed and cannot return to sleep. Despite this, he feels unrefreshed and exhausted throughout the day. His appetite has decreased dramatically, leading to an unintentional weight loss of approximately 15 kg over the past 6 months. Liam reports no prior formal diagnosis of mental health disorder. He recalls a period of feeling down during his university years, which he attributes to academic stress and it resolved without intervention. He denied any history of being or hypomanic episodes. Medical history. No significant medical conditions. He takes no regular medications. He reports occasional alcohol use, primarily socially, but denies current substance abuse. Family history. Liam's maternal grandma has a history of depression and his father experienced a period of severe depression following the death of Liam's grandfather. Social history. Liam is married with no children. He describes his relationship with his wife as gentle supportive but admits his current symptoms have strained their communication. He has close-knit groups of friends from university but has largely isolated himself from them recently. He reports a relative stable and successful career as a software engineer until the onset of his current symptoms.
So this case is about major depressive disorder and the major role is depression. So this guy have undergone depression as so many days and he has a family history and genetic history like his father, grandfather have all undergone the depression. So what would be the symptoms of depression? Anyone answer? What would be the symptoms will the depressive person undergoes, like sleeplessness, hopelessness, he may feel worthless and
Eating disorder.
yes, he may not feel hungry or he may overeat. And even sleep patterns may change, like he can sleep till 10 to 12 hours or else he may not sleep even an hour. So it depends upon the patient or depends upon the person. So depression is itself a major, lead a major issue in their life. So for these patients, they can prescribe both drugs as well as medication as well as psychoeducation. That is with counseling and psychotherapy. So the treatment plan can be like first the psychiatrist can prescribe them antidepressant drugs and with the antidepressant drugs they can prescribe the drugs for a week or 10 days. After that they can accompany with psychoeducation, which is like giving proper counseling to the patient, to the family members, etc. Once the counseling is taken, after the first session of counseling is over, for the next session, the patient may give Beck's depression or any depression inventory to check the level of depression, whether the depression level have been reduced. To check like whether it is in the same severe level or in the after once completing the research process, again we can give the proper counseling through cognitive behavioral therapy or on the applying behavioral